Great. So, pleasure having you here. So as far as low vision supplies, this is what we offer for patients. And as far as a whole array of different types of magnifications, distance telescopes, bioptic telescopes, reading telemicroscopes, and as far as demonstration to patients, we have a whole supply of pre-made up so we can try to simulate what we're trying to have them
So
use.
you would have them wear, like, in the exam itself, like, as similar as what you would try to make up for them?
Correct. So we have a whole tray here of what's called trial lenses. And the trial lenses basically are to trial the patient's prescription. And once we put the patient's prescription in here, which would be the accurate prescription, this would be their best correctable acuity.
Yeah.
And then we would show them as far as putting a lens on to then trial it, if it would be one eye or both eye.
Right.
And then when that is done, we would show them the way we would make up a pair of glasses, and it would be necessarily in this frame, but this would be a finished product. And what's incorporated in here, what makes a telescope a sophisticated item, is having their prescription incorporated into the telescope, having the telescope mounted, and it's the best attainable acuity. These are really just for task-specific viewing straight ahead. It's not meant for walking. It's like having a pair of reading glasses, if you will, right? Or distance that you can't read with. It's one thing.
So maybe television or something like
Television, theater, kids are outside, they want to do things, they put them on. These are much easier to work with because you can do both. You can walk, you can talk, you can see people. When you want to see them better, you tip down to see them clearer. And then hence, as we have a lot of patients who are musicians and do computer work, so we have glasses set up for close work, which is now just the opposite. And this is typical to surgeons' glasses.
Right.
So you have distance, and when you look down, you would have it for reading, you would have it for hobbies, you would have it for computers, and the pitch would be designed specific for that patient. And what makes this sophisticated is that we have the prescription in the top, we have the prescription incorporated into the telescope, and then it's specifically set up for a working distance, be it piano, be it computer, be it crafts. And these we have all different ones made up for patients to understand what we want to use them for.
So they want to, let's say they want to do both. They want to see distance, they want to see close.
So a lot of people need to get two types of things. If you want to do both, we talk about having a telescope like this, which is a full diameter.
Yeah.
If this magnification works, which is great. And then what happens is we put a reading cap to put over here to now convert this into reading.